Radhe Radhe. Welcome to our health webinar series. And we have today Dr. Karanjit Kooner. He'll be talking about glaucoma, and that is a very a topic that is all people look for. Thank you very much, Dr. Karanjit, for taking time from your busy schedule to join us in JKYog Health webinar. And I would also like to thank Dr. Khandelwalji for getting us together for health webinar. And let me go and introduce Dr. Karanjit Koonerji. He's an associate professor of ophthalmology at the University of Texas Southwestern Medical Center, Dallas. He's specializing in the management of glaucoma. He graduated from Dayanand Medical College in Ludhiana, India, followed by training in ophthalmology in Belgium, UK, and in the USA, where he completed 2-year fellowship in glaucoma at the Ochsner Clinic and Louisiana State University, New Orleans. Dr. Kooner has trained over 40 glaucoma fellows from the US and overseas. His research interests include early diagnosis of glaucoma, surgical therapies, and patient education. He has published over 40 papers and done medical mission work in over 10 countries. Thank you very much for joining us, and over to you.
Can you see my screen?
Yes, we can see your screen.
Hello, good evening. As Binaji said, my name is Karanjit Kooner. I am at the University of Texas Southwestern Medical Center, and it is a great honor to be here today. By inviting me here, it feels that I am at home to be able to talk freely with friends and people all over the world. I will try to make this subject easy to understand because it's a complex issue. And of course, at the end, we'll have more time to answer some of your questions. Let me start out by saying that glaucoma is a worldwide disease. It is not prevalent in just one community or one country. It is a worldwide disease. And the other features are that it is the second leading cause of blindness. The first leading cause of blindness is cataracts, and the second one is glaucoma. In the US, we have over 3 million Americans who have the disease, and worldwide, over 76 million people have glaucoma. So as you can see that this is a huge public health problem. And one of the difficulties about this disease is that it does not have many symptoms. So you may have glaucoma, but not know about it. And as the population is aging, we're going to see more people with glaucoma. And the other reason is that with our new technologies, we are able to diagnose glaucoma very early. As you will see during my lecture, it is seen in children, it is seen in young babies, and of course is seen in older population. The etiology, the cause of this disease is very complex, and some people have spent their lifetime trying to figure out why one person gets glaucoma. Over the years, we have come to know a lot about this disease, and if it is detected early, the outcomes are very good. So let's look at some of the risk factors. And all of you in the audience, if you have any of these risk factors, then it is very wise for you and the family members to go and get themselves checked for glaucoma. As I mentioned before, not many people have any side effects or symptoms from the disease until very late in the disease process. So number one is the eye pressure, and we'll talk about what eye pressure is. So the difference between cataract and glaucoma is in cataract, the lens becomes white. So it's like seeing through a screen, and difficulty to distinguish between colors and faces and so on. Whereas here, the pressure starts to rise in the eye. And the second one is the family history. So I'm sure there are a lot of people in this audience today who have a family member with glaucoma. And once you begin your life with a positive family history, you have 7 times higher chance of getting glaucoma down the road. And this is something that we try to teach the primary care physicians, we try to teach the internist, we try to teach the pediatricians and the general public, because one of my passion is teaching. And you will see that we have designed several handouts which are very well appreciated by patients. But if a person is born in a family with glaucoma, that should be the priority of everyone, to get that child tested for glaucoma as early as possible. The other issue is race. And what we have found that Black race, anyone who has dark skin has a higher chance of getting glaucoma. So for example, in the US, patients who have African descent, they present to us with a lot of damage to the eyes, and their glaucoma is very difficult to control. And the same is true in India or any other country. If you look at the prevalence of glaucoma, it is about maybe 2% of population over the age of 55. In the US, India, and in India, we don't really have very up-to-date statistics. But in Africa, especially Western Africa, the countries of Ghana, Nigeria, Cameroon, Mali, those countries have 7% population over the age of 50 who have glaucoma. It's a huge problem. And many of our patients in the US that we see come from those countries. And once we see a patient with even a slightly raised pressure, we become very aggressive and treat the pressure well. Now you will see that pressure is not the only risk factor. The family history, the race, hypertension, and diabetes. Now, as you know, there is a pandemic of hypertension and diabetes in every country. And they directly or indirectly affect the blood supply to the optic nerve. And I'm going to show you some pictures of what an optic nerve looks like. And then older age. So it's a disease of older population, especially after the age of 55. And the other is something called central corneal thickness. This is more technical, but I'll show you what a cornea looks like. And if someone has a thin cornea, then that person has a higher chance of developing more severe glaucoma. So any of you who have these side effects, risk factors, then they should make efforts to see their eye doctors. As I said, in just a few more years, the population is going to jump from 3 million to 4.2 million in the US. And we will have difficulty controlling and treating these patients. So the future can be challenging. And the only way we can deal with this issue is to diagnose these patients early. I know that the new technologies are able to let you check your pressures at home. They let you check your visual fields. So hopefully when we can get these patients earlier, then the outlook may be better. So I know this is very technical, but I just want to point out that the eye is a very complex organ. It is only 1 inch in diameter, but just look at how much, how wide field and how details we can see every day and enjoy the world around us. It is only, as I said, 1 inch in diameter, but it is connected to the brain. So the eyes are outpouching of the brain. One of the advantage of this is that we can look in the eye and find out about what's going on in the brain, especially blood supply and nerve fiber issues. And I'll talk to you a little later. So this front part is called the cornea. This is the clear part of the eye. And then there is a pupil and there is a lens. So the disease of cataract affects this part, the lens, whereas glaucoma is different. So here on the left side is the eye that is healthy and normal. Over here, you can see the optic nerve is nice shaped. But what happens when the pressure builds up? When the pressure builds up, the first damage that occurs is on the optic nerve right here. And the reason is the eye is made of an outer wall of sclera and cornea, which are pretty tough, whereas the optic nerve passes through this gap in the sclera, and that's why it becomes very vulnerable to damage. So going back to the age factor. So here's the prevalence, and these are the ages. So as we get older, the prevalence goes up. So for example, let's look at people who are over 80. Especially patients who have dark skin, there are almost 10 to 11% of those patients have glaucoma. So I see these patients all the time. They come for routine eye checks. And when we look in the back, there is evidence of glaucoma. So age is definitely a factor. So my advice would be that everyone should get their eyes checked at least once a year for many of the eye diseases that can be detected early on, the cataracts, the glaucoma, and macular degeneration. Now, the other issue I want to touch is myopia. Myopia means that you cannot see distance. You can see maybe things close to you, but without glasses, you cannot see distance. So that's called nearsighted. Now, the problem with being myopic is the eyeball, the shape of the eyeball is different. It is much longer, bigger in size. So everything gets pulled. So the retina, the optic nerve, everything gets pulled and becomes vulnerable to high pressures. So how bad is myopia? Just let's look at this slide. Just a few years ago, the prevalence of myopia was about 30%, or maybe 25, let's say 25%. Today, it is 34% of the world population. This is a world population. In the next few years, 50% of the population of the world will have glaucoma, will have myopia. And there are several theories why people become myopic, but it doesn't matter if a person is the poor country, underdeveloped, developed country, we are seeing very high prevalence of myopia. Now, within the myopes, there is another group called high myopes. So those of you who have myopia, or those of you who understand this terminology, high myopia means anyone who has uh, uh, myopic defect of -6 or higher. Now, this group of patients are at a very, very high risk of getting glaucoma and macular degeneration and cataracts. And we'll show you some statistics. But again, the highly myopic group is also rising. Now, I just want to show you how the optic nerve looks like. For example, the slide on the left side is a patient who has glaucoma, and you can see is pale and there's a little cupping in the center. Whereas the one on the right is a patient who does not have glaucoma, but is highly myopic. So before we had our new technologies, these patients were always being treated aggressively with glaucoma. And so in one way, even though they have high risk of getting glaucoma, not everyone should be treated. So this is where the new technology, optical coherence tomography and geography are going to help us in the future. Unfortunately, those technologies are not available everywhere. So let's see how myopia affects the health. For example, low level is -1 to -3. They still have 2 times more chance of getting cataracts compared to the general population, 2 times more glaucoma, 3 times more detachments, and then also changes in the macula. But see what happens if a person moves from -3 to -6, which is very, very common. Most of us are going to be in this range. Look at the chances of getting cataracts, glaucoma, detachments, and macular degeneration or maculopathy. But what about this over -6? It jumps up to 5 times more than the general population for getting cataracts, 14 times more chances of getting glaucoma, 22 times more chance of getting detachment, and 41 times more chance of getting myopic maculopathy. So if you are myopic, my suggestion to you is that you should be aggressively seeing your ophthalmologist or sometime optometrists for any signs of these diseases. So I'm sure when you go to an eye doctor, you will get your pressure checked, and it's checked by this machine called applanation tonometry. It will touch your cornea momentarily, and the pressure reading comes out. The average pressure is about 16 millimeter of mercury. So I know most of us remember what is a normal blood pressure. Okay, we say normal blood pressure should be 120/70. All right, but many of us do not know what our normal eye pressure should be. So remember today, if there are a few points I want you to take home with, is number 1 is pressure of 16. Remember that all the time. So when you go to next time, get your eyes checked, ask the doctor, what was my pressure today? And they might be surprised, but at least you are getting in charge of your health. And if you find the pressure of 20 and then you ask them, hey, is this worrisome? What should I do next? And because unless you ask, sometimes things just get passed. So average pressure should be around 16. And then we also check the back of the eye, the optic nerve that I showed you some pictures, and I'll have some more. This is a very important test. And then, of course, this is the slit lamp that helps us magnify things by almost 16 times. So we can look at the cornea, the lens, the iris, and the retina. So just to give you a little bit background for anatomy, you can see the cornea, the pupil. Everybody knows what the pupil looks like, and the iris, and the lens. But the fluid is formed by this structure here called ciliary body. And that fluid actually goes under the iris and comes out through the pupil and then gets out of the eye. In glaucoma, the problem is right here. There is a sponge-like tissue that lets the fluid out of the eye. But in glaucoma, those little pores get blocked. So the pressure goes high, and and we try to reduce the pressure by opening up um, the pores with either medications or lasers. And then, of course, we have to use surgery. Again, just to show you how the optic nerve and the retina looks like, this is the optic nerve, and there are a lot of blood vessels, and these are all healthy. And this is the fovea, which gives us the best vision. So remember, a normal optic nerve looks nice and pink, but as the glaucoma progresses, it will change. For example, the optic nerve on the left is of a normal person. And you can see here, there's a central cupping, which is normal. But look what happens in glaucoma. This person has lost a lot of nerve fibers, and now the whole optic nerve is almost cupped. So we want to see patients at this stage that you see on the left, and not on this stage. But unfortunately, most of our patients who come present very late. Here's another picture. And you can see there's a lot of cupping. This person has lost a lot of nerve fibers. Again, to give you example, for example, the B is the normal, and then C, D, C, B, and A are all abnormal optic nerves. Here's another patient I just saw recently, and the poor person has very, very poor vision in this eye. So one of the tests that we do in the clinic is called a visual field. So visual field is nothing but checking your side vision and the central vision. So one eye is covered and the other eye is shown little dots, and then we try to figure out, how many dots do you see. For example, in this patient, the light part is where the person can see, whereas the dark part is where the person sees very difficult. Now, this is an example of an eye that has lost severe glaucoma, has lost most of the vision. So they have only the central tunnel vision. Now, the problem with the vision is that a person with this much vision loss will still have 20/20 vision. He may still be driving. And the problem is that one eye is affected more than the other. So unless you check your vision with each eye every morning or whenever, you cannot find the defect, because when both eyes are open, one eye is going to overlap the other eye's vision and take care of any blind spots. So the other take-home message today is that if you are worried about your vision from whatever reason, then I would suggest that while you're watching TV, cover one eye and see which one sees the best. Now, we always have dominant eye and non-dominant eye. That's a little bit of difference, but I'm sure the person whose visual field this is, if he had covered the other eye, he would have been surprised to see how dark everything around the room is. So this is another example of A is a normal, B would be early glaucoma, C is moderate glaucoma, and D is severe glaucoma. So the other question you should ask your physician every time you visit them, and eye doctor, and say, doctor, what level of damage do I have? So not only the pressure, but you need to know what level of damage you have. I think it will make your physician be very aware and try to teach you more and show you more and pay more attention to you. So how do we treat glaucoma? The first method by which we treat glaucoma is with medications. Now, medications have been with us over 150 years. So one of the common drugs that we still use is called pilocarpine, was introduced in 1860. And then slowly and slowly we progressed. When I was a fellow, we only had like three drops for glaucoma. And life was easy. I thought this was the easy branch, and and how much do we know about this? I can't make mistake in with 3 drugs. But I was surprised that there is so much knowledge now. Everything has become complex, and we have so many variety of drugs available that we can tailor it to a particular patient. So this is just a partial list of glaucoma drops available. There are tablets as well. And how do we pick a medicine? And I think this is where you can play a role as well. So how do I pick my medicine? Well, I pick my medicine based on the person sitting in front of me. If somebody is young and very energetic, they have a very active life, I want to pick drugs that he doesn't have to use more than maybe 1 time. But what about this lady who is on fixed income? She also carries a bag full of medicines because she has diabetes and arthritis. I don't want to burden her with expensive medicines. So we would pick something that is easily available, is not very difficult to insert. And this is how my initial thought goes to patients. I want to help them, and I look at them and I figure out, how can I make her life or his life a little easier. The second way we deal with patients is to see what other medicines they are taking or what other conditions they have. For example, if a person has asthma, then there are certain drugs that we just cannot give them. If they have allergies to sulfa medicines, then we avoid certain drugs. So taking a good history, and as a patient, you should also provide the physician with as much information as you can. So we need to find the best combinations for the patient. The other issue is, how do we put the drops in? In busy practices, physicians usually don't have time to show you how to put the drops in. And this is one area that I impress upon the residents and medical students and the fellows, that you just cannot prescribe a medicine to anyone without showing them how to put the drops in, because you'll be surprised how ingenious ways people find to put the drops in. And most of them may not be the correct way to do it. So here's another one, she's just dropping on the eye. She's trying to pull the lid, but the lid is still in contact with the eyeball. So what you need to do is to pull the lid so that there is a little space, a pouch is formed, and that's where you put the drop in. Now this person is putting drop where half of it is already outside the eye. And then we see them after a month and see the pressure is still not controlled. So patient education is high priority for us. So we have these few slides to show you, and what I would suggest that anyone who's using eye drops is, the first thing you need to do is to pull the lower lid down and make a pouch. Then you make sure that you put the drop in that pouch. Now you can see the lake there, right? And don't let the skin go back. You need to let it. You can pull the lid and let the drug stay there for a few seconds, or at least about a minute, and then you gently close your eyes. Now, once you close your eyes, the medication gets absorbed very, very fast. Now, the other things you can do is close the nasolacrimal duct, or you can do what this lady is doing on the last picture. But I think for majority of us, just gently closing the eye is going to be enough. Now, if you don't do that, the blink is going to push the medication out of the eye, or it'll pump it through the lacrimal system into your throat. So simple steps like this can make a big difference. So instead of putting somebody on 2 or 3 drops, I think maybe 1 drop would be enough if they were using it properly. The other thing we do is provide them with a lot of handouts. Now, this is the handout that we have designed. Um, so you can see that the first column is eye, so it can be right or left eye. Here's the medication. And there are 1, 2, 3, 4, 5, 6, 7, 8, and even more now, 9 different categories of eye drops for glaucoma. So for example, if I pick Timoptic, then I'll circle this and I'll say both eyes in the morning and evening. And if they are on a second drop called, let's say, latanoprost, maybe, but it's only for the left eye, then I'll circle left eye and I say this will be the evening. So at least they have something to fall back on, because one of the biggest issue of being non-compliant with the medication is forgetfulness. Okay, so not only old people forget, even young people forget. So forgetfulness, so this is a reminder that they can stick it on their refrigerator to remind them of their duty for medications. So we have done a number of studies where our medical students will sit down with the patient and show them this handout and also show them how to put the drops in, and they will call them after 3 weeks or maybe a month. And we have found that the compliance rate goes very high. So these are as important as prescribing a medication. So as a physician, we always teach our residents and students that you have to be a whole physician, holistic approach, and focus on the patient and look at their issues and their handicaps and try to help them. Now, remember that each of these medications has their own set of side effects. So don't think that, these eye drops are not causing problems. They can cause big time problems, especially with asthma. They can cause heart problems. They can reduce the heartbeat. They can reduce your energy levels. They can sometimes interferes with your sleep. So unless you tell your physician that I'm having these issues, they may not be able to help you. And then on the back side of this paper is we show them how to put the drops in, just like we discussed. And then we also have frequently asked questions like, what is glaucoma? We describe what it is. What is intraocular pressure? And the tips like use your drops every day and preferably around the same time. Make it part of your life. And you try to schedule your eye medication with daily activities like upon waking or after brushing your teeth or after breakfast, lunch, or dinner. One of the biggest challenges when I see a new patient, then I always ask them, what is your profession? They say, I'm a truck driver. Well, when somebody's a truck driver, then forget about any kind of routine in their lives. And you really have to think about how they're going to use their medicines. So you want to give them medicines that don't easily get damaged with change in the temperature. And the other group is people who work at night. So there are some nurses that work from 10 o'clock till 5 o'clock. So we can't just tell them, hey, use this drop at night before you go to bed. Well, they go to bed at 7 in the morning. So unless we find out more about the patient, I think we are doing a misservice. So as a patient, you should be forthright in saying, hey, this is my job. I only work on weekends, or I work different hours, and then the doctor has to figure out a way to help you. So after the medications fail, we go for laser. So what the laser is trying to do is to open up those channels that I showed you. And it's very effective. Of course, it doesn't work in every case, but that's our second line of treatment. The third line is surgery. Now, surgical treatments are not easy to perform, and we have to really be careful of what type of surgeries to do on what type of patients. So we have choices. We have very fine shunts that we can use to help bring the pressure down. But here, unfortunately, the problem of money comes in. For example, in countries like India and China and Asia, they cannot afford the new shunts, which are expensive. And this is very unfortunate because most of the people who need help are in those countries. And when I go overseas, it breaks my heart to see patients not be able to afford very common things that, over here we have no problems with. But that's what's going on in the world. So here you can see in the eye, we have made a channel, and that fluid from the eye starts to collect here, which you can see is called a bleb. Now, the options that I like are these shunts. They are made of very fine long tube, and one end of the tube stays in the anterior chamber or the front part of the eye, and the other goes way back about 10 millimeters from the eye, and it drains the fluid way out back. So you don't see the bleb formation, and they work well. But the problem is this technology is still about 30 years old, and fortunately, I had the opportunity to meet with some bioengineering students from our local university, and we have designed a much smaller, more efficient, highly predictable shunt, which is still in the testing stage. But that's what we need. We need better and better surgical procedures. Now, this is how the tube, anyone who has had tube in the eye, this is how it looks in the eye. Of course, you can see the pupil, the lens, and the iris, but this is where the tube is draining the fluid. And here again, we are using laser. Now, most of the patients with glaucoma do not have any symptoms or signs, but some patients do, especially with a variety called angle closure glaucoma. And it's relatively rare. It's only about 2% of glaucoma patients, and seen in elderly patients, and they'll come and will complain of a lot of eye pain, and they'll see rainbow-colored rings and so on, and the pressure will be very high. Now, this is the technology that I was talking about. This is called OCTA. It gives us information, not only the layers of the retina, but the blood supply. And by just doing one screen, I'm able to gauge whether this person is normal or does he have mild, moderate, or severe glaucoma. So here we get about 40 different variables on each eye in the patient. So those of you who have interest in biostatistics or bioinformatics, so we are using artificial intelligence, deep learning models to predict who has glaucoma and who does not have glaucoma. Now, let me remind you that glaucoma occurs in children as well. And the children, glaucoma is very, very bad. Unless it's picked up early, they become blind. So for example, because the child's eye is soft, when the pressure starts to build up, the eye becomes larger. So it doesn't happen in adults, but in children, if you find somebody with so large corneas, they should be checked for glaucoma. Now, as I said, I travel to many countries every year or so, and I see a lot of children. For example, this was my visit to Bangladesh, and look at all these women. They brought their children, and each one of them has congenital glaucoma. And here's another lady. See, both her eyes, this little baby's eyes, have glaucoma, and the treatment for this is surgery. But let's see. Let me give you an example. In Dallas, we have 250 ophthalmologists in Dallas. In the whole country of Bangladesh, there were 150. And you can just imagine, and most of them were in Dhaka, so, or Chittagong. Beside that, these poor people, they come from villages, and I know some of them drove like uh, took buses for almost 1,000 miles. So this is what's going on. So as I said, I've been to China, and everybody is interested in learning about glaucoma and what is going on, because this is a terrible disease. And so uh, this is again in Dhaka, and doesn't matter where you go, you'll see young people, you'll see old people, you will see males and females. This affects every age group. And this is in China. Again, you can see young people, old people, some needing a lot of help. And this was in Cameroon. Again, so it doesn't matter where you go, you will see the same type of uh, patient population. But most of them really need help, and hopefully we'll have a better surgical procedure to take care of these issues. And then one of the aims of our organization, I belong to this organization called Orbis. They have a DC-10 airplane, and the airplane has been converted into an eye hospital. So they go to different countries and stay there for a month. And then people like me, go there for a week at a time. So we do surgeries on the plane, but this is actually in the local hospital, because we want to teach the local physician. For example, this lady, she's the ophthalmologist in that hospital. And first I'm doing the procedure, and then I'm going to let her do the procedure. So our aim is to teach these physicians so they can go back and start treating patients. The last thing I want to talk about is diet. So here we have another handout. It's called Food is Medicine, and save your sight by eating right. And this is true for every one of us. Every one of us should be focusing on these things. For example, for anyone with glaucoma or cataracts or macular degeneration, they should be looking into these eye supplements. There are companies that make them focused on the eyes. They have everything. They have zinc and lutein and folate, everything, chromium. So you have a choice to buy them. For example, here in the US, Preserve Vision, iCap, Ocuvite, Optic Nerve Formula. But B complex, vitamin C, and D3, they're very, very essential. So regardless of what age you are, and what diseases you have, these are, the first four are very critical, and then you can go for CoQ10 or ginkgo biloba or resveratrol. Now, those of you who want to get vitamins from the source, for example, vitamin A comes from carrots and squash. Vitamin B1 comes from whole grains. Vitamin D comes from milk and mushrooms. Vitamin E from almonds. Chromium from apples and bananas. Omega-3 fatty acids from flaxseed oil. So here you have your kitchen is your is your pharmacy. You should be storing all these sources of good health for the whole family. On the back side, we are saying that plant-based diet. Stay away from meats as much as you can, because they are just I mean, the way the hormones and medicines they put in the meats is very harmful to the body. Exercise for at least 30 minutes, and we need to control your stress. Yoga, massages, and make hobbies, and we need to avoid this type of toxins like smoking, alcohol, and soda. All right, so I'm going to end here. I hope I didn't go over my time, but I want to show you this video. We actually competed in a competition last year, and our presentation did win an award, and I think this was one of the reasons. So if a patient is late, then he's going to fall in that optic nerve cupping that we just talked about. It'll be very hard for the person to get out. We need to catch them way ahead before they fall into this hole in the optic nerve. So thank you so much, everyone. I hope you got something out of this, and I will be happy to take your questions. Can you hear me? I can't hear you.
Thank you very much, doctor. Yeah, you can hear me now?
Yes.
Okay. Now we have so many questions, but I want to say this presentation was excellent. My mom she also has a glaucoma, and I didn't know all these information. I think I'm going to help her now. I'm going to see how she puts her medication. You know, uh, I know she does it by herself, but I don't know how she does it. She just opens the thing and then puts it. And as you say, maybe it's falling out one drop. I know she has to take one drop and half of it is outside, so I need to be careful. I'm going to check that with her. So now the questions we have, we have any, Supriyaji is asking question. Can we do any exercise or take precautions to avoid the condition?
That's a great question. I think as far as exercises, I don't know of any studies that have been done. I know that if you press on the eye and do a little massage, the pressure does come down, but it's only momentarily. So the reason I know is that when we do eye surgeries, sometimes the pressure goes high, and we, before doing surgery and after we have given the injection, we can massage on the eye and the pressure does come down. But I don't think that it's, unless you do it several times a day, it's going to be effective. So the question, the answer would be that, if you are worried about glaucoma, then I would go and get your eyes checked with the latest technology if possible, and know about your numbers, know, hey, what is my central corneal thickness? That would put the doctor surprised that this person is interested. So I think the eye health is connected to your general health. So if you do exercise daily and take care of your health, what you eat, and if you have diseases, which we can't control it, still staying focused on your general health is going to help your eyes.
Okay, thank you. Now, there's a question from Prem Babajaji. He's asking how to decide whether I should go to optometrist or ophthalmologist.
Excellent questions. So remember I showed you that the prevalence of glaucoma is going to go sky high. When I was a fellow, I think at that time there were only 1.5 million Americans with glaucoma. Today it's over 3 million. Another few years, it'll be 4.5 million. And there is a shortage of specialists. And my answer to this is that if the optometrist can check your pressures and give you a decent review of your test results, then I think it's okay to just go there every year for pressure checks and looking the optic nerve. But if not, if you are worried, especially if you have those your risk factors, then I would go and see an ophthalmologist. Unfortunately, we have general ophthalmologists and we have specialists. And everyone is becoming busy. For example, I see patients 3 days a week. Other days I'm doing research or surgery. Every day I'm seeing about 50 patients. So you can imagine these are going to be new patients, follow-ups, surgery. And so the glaucoma specialists are getting very, very swamped. To give you an example of how many glaucoma specialists we have in the world, let me tell you that it's not more than 1,500 for whatever billion people. How many? 7 billion people, 8 billion people. So I would just I tell my patients, be captain of your ship. Don't let this ship sink. you do whatever you can, whatever you need to do to see anyone who gives you a good answer, and then follow, do your general, we have that pamphlet we describe, because food is medicine, and you need to take care of that.
Thank you for that answer. Yeah. Someone has asked, does exposure to computer screen increase eye pressure?
Interesting question. The how I showed that myopia is on the rise. There are a lot of studies that are showing that because the new generation, people who are in the 30s and 20s, they are spending so much time on their cell phones and iPads and computers. It is taking a toll on their eyes, and it's making them more myopic. When I was growing up, you could get into a classroom and see how many students have glasses. You can pretty much say that they are the scholars. The others are not. So in China, in Japan, in Korea, even in India, there is so much emphasis on reading, passing your test. Well, that's putting stress on the eye. Coming back to the question of eye pressure, within reason, if you are reading, that actually decreases your eye pressure. Okay, but you can't be doing it for a long time. The other thing about computers is that there is radiation coming out of the computer, and that radiation is bad for your retina. It is bad for your cataracts. So I don't think there is anything good out of the computer unless you want to use it for a short term.
Okay, thank you. Now, Vinod Kapurji have asked a question. How effective is the laser surgery?
That again is a is a complex question. How effective? I would say. Let me give you an example. So the fluid in the eye passes through that sponge-like tissue, which the laser is trying to open up. But the channels after that are pretty long by the time they get into the blood supply. So a person who has issues within their sponge, they might respond, but then others who have issues beyond that may not respond. But I'm a believer of laser. I think laser should be attempted very early on. My philosophy is that when a person is on more than 2 eye drops, then I jump into lasers, because sooner the better. There are some studies where say if you do laser first, there's a good response. But again, our patients many of them are scared. They don't want to jump into lasers as the first line. There has to be a rapport between the patient and the physician. And if I am not able to convince the patient sitting in front of me, he or she is not going to be doing or following our instructions. So the answer to this question is yes, it's effective, but it also depends on so many other factors.
Right. Okay. Thank you. Thank you. Now, Rajesh ji has asked, Rajesh ji Chugani, how do you measure eye pressure at home? Is there any device that we can buy or something that we can do at home?
Let me say that it is not necessary to check your pressures at home. If you have a pretty good, decent readings from your doctor's office, I think if you're concerned about pressures, I would spend maybe a day in the doctor's office and let them check your pressure 4 times, early in the morning, midday, late afternoon, and then last thing. So that will give us a very good pressure range during the day. But it is true that our pressure is highest pressure recorded is nighttime when we are asleep. So There are so many reasons why that happens, but it's to do with the the heart slowing down, blood pressure dropping, and a little bit congestion, and difficult for the fluid to get out. So we have done studies where we check pressures, day and night, and we found the highest pressure is around 3 o'clock to 5 o'clock in the morning. Now, those of you who have blood pressure, this is a big problem because at night our blood pressure drops, but the eye pressure goes up high. That is the worst combination because the optic nerve needs the blood supply, right? So at night, the blood supply to the optic nerve is compromised. So the blood supply is not as active as in the daytime, but the eye pressure is high. And this is where, and we believe that most of the damage in glaucoma occurs at night. So, and to answer, there are some ways of checking pressure, but you have to do it through the eyelids. So there is a machine. It's like a pen, and you touch it, and it'll give the reading, but you have to press on the lid a little bit. So it's not that easy. Right now, one of my projects is trying to design a contact lens that I can put in the patient's eye, and which will have a chip, a sensor, and that will check pressures every half an hour, 15 minutes, and send it to a server where we can see how that patient did. So it should be coming out. I think that would answer your question better. But so the way right now, I would get your pressure checked different times of the day, and otherwise stay on top of the medications.
Okay, thank you. Yeah, someone has asked, Hari Priyaji, do we need to go for test after a certain age, or anyone who has long or short sight needs to get tested often?
And the answer is, if somebody has a long or short eye, they have to be tested often. The answer is yes. Now remember, the earliest you can get a good test on a child is when they are 10 or older. Mm-hmm. So definitely, I think if your mom and your dad or one of your brothers is highly myopic, then this person should get a thorough eye exam by an ophthalmologist at age 10, and then they will say, okay, you come back in 5 years or 5 or 10 years or so on. But for a person who doesn't have all these issues, then I would say that everyone after the age of 50 should get their eyes checked every year. And then once we cross 60, then it may be a little bit more. Oh, I'm sorry. When we cross 50, then we should do it every 2 years. But by the time we go 60, it should be yearly.
Okay. All right. Thank you, doctor. And now someone has asked, is it recommended to have a cataract surgery after 80 years old, or?
Well, it depends on if you are interested. Our technologies have really become very efficient. So age is not a barrier. It all depends on if it is affecting their vision. Yes, I have patients who are in their 90s that they have cataract surgeries done. So it depends on the lifestyle. It depends on what the person needs. Of course, we do extra testing to make sure the cornea is healthy, the retina is healthy, they have no glaucoma. But their age is not a problem in this age.
Okay, thank you. And someone asked about a lazy eye. If they have a cataract in a lazy eye, is it necessary to have a surgery or leave it, or how does it work?
Lazy eye, by definition, is that one of the eye just did not develop vision. It may look normal from outside, but for whatever reason, and there are several reasons, that it did not develop as good vision as the other eye. So if that eye develops cataract, the person may not notice much change. But again, there is no medical reason to do this. So I have done surgeries on patients, who said, well, um, I know I can't see from this eye in the center, but I have a nice side vision. So I would like to get my cataract out because at least, I need my side vision to help me out. So and the answer would be yes, but depends on what you would want, not what the physician says. But if you think getting that cataract, or 5 years before this cataract started, was your vision better?
Thank you. Yeah, I think that explains. Yeah, it should be helpful, right? And someone has asked, does yoga help for any eye health, or if there's any specific yoga that they can do to improve the eyesight or glaucoma conditions?
So this is an excellent question, and I do believe in yoga. I think yoga is one of the finest contribution of India. Um, but remember that not every uh, pose, every type of yoga is good for the eyes. For example, headstand. If you are doing headstand, that is bad, bad, bad for the eyes because that raises the pressure. So one thing you should avoid when doing yoga is avoiding a headstand. Uh, yeah. So otherwise, I think all the others are excellent.
Okay, right. Are there any methods that can prevent glaucoma, or any dietary or lifestyle changes that we should do? I know you mentioned about the food that we should, get all the foods in our kitchen, act as a pharmacy. But anything else that we can think of?
Um, you know, food as medicine and food to prevent diseases is very near and dear to me. Many times patients say, hey, you are telling me more than my internal medicine doctor. He's never told me that this is not good for us. I would say that vegetarian diet, avoiding animal products is going to be helpful to your general health, to your brain, and the eyes. And vitamins. Yeah, I think definitely the diet and the vitamins that I mentioned, they are preventive. So you can prevent many of your eye conditions, or even memory issues, by following the list of vitamins that I mentioned, because that has taken a lot of time for us to do research and try to figure out which ones are the best for the brain, heart, and the eyes. So the three of them are connected. If your eye is healthy, your heart is healthy. If your heart is weak, your eye is going to be weak, or the brain is going to be weak. So they're all connected. You can't escape it if one of them become diseased.
Okay, thank you for that. And I remember you mentioned that we will not be able to identify if we have a glaucoma, like someone may be driving 20/20 vision. So how do we determine? Suppose we are not going for a test, maybe some people don't have medical aid and all that. So how do we determine, or how do we find out whether we have glaucoma, or symptoms of glaucoma?
Yeah. So unfortunately, open angular glaucoma, which is the most common type, does not have any symptoms till the very end. Okay. So I think testing your eye with one eye at a time will be big. Also looking if your color is changed. You could see all the colors of the rainbow, and now there are certain colors missing. That would be one. Also poor vision at night. So if you're just having difficulty, driving at night, or seeing in poor light, or needing for glasses to change. You changed one pair 6 months ago, and now you think I need another one, and after another 6 months. So this frequent glass change is an indication that something else is going on that needs to be checked.
Okay, I think yeah, that's a very good you know uh, not an example, a very good tip for us to know that yeah. Thank you. Someone says, how about wearing contact lens? Does that help or does that affect glaucoma or?
Um, so there are two types of contact lenses. One is soft, which is, no consequences, is no problem there. Some are hard, and the hard contact lenses can change the shape of the cornea sometimes. But overall, I would say contact lenses are not a problem. So if you need to wear contact lenses, then go for it. Yes, no problem.
Okay, should we go for a few more questions or?
Yes, yes, yes.
Okay. How about glasses? Are glasses better than the contact lens or? Because we have like after certain age we have been wearing contact lens all along, and then after certain age it's like we need to change to a glasses, or it is more effective or more better to have glasses. So is that true, or how does that?
Um, so when we reach age of 45, then something dramatic happens. Okay, things that you could see very well, you don't see anymore, and and the reason is the changes in the lens. So remember, I showed you the lens.
Mhm.
So when we are young, that lens is very active. It will expand, it will thin, expand and thin to help us see distance and close. So, but around 45, we are walking into a new phase of life, and a lot of things are changing. Um, Now, the reason we need glasses is because the lens doesn't focus as much as like before. So we need to do, so some people will say bifocals, upper portion for distance. So this is bifocal. But there are contact lenses nowadays, excellent contact lenses, which are multifocal. So you can still use your contact lenses, and you'll be able to read and drive and uh, do whatever. So glasses are not necessary, but contact lenses, well, for contact lenses, you need to take care of them. You need, if you have issue with dry eyes, then there'll be a problem. And if you don't, clean them regularly, then they can get infected. But otherwise, I think in today's technology, the multifocal contact lenses are just excellent.
Okay, thank you. And doctor, you also mentioned that it is heredity or a family history, right?
Mhm.
So now, suppose if I want, like I'm talking about myself here, how do I? Are there any preventative measures that I can take to prevent glaucoma happening to me,
Um,
apart
it,
from
it,
apart from food and the lifestyle changes that
I
I would
think,
make? Anything
yes,
else?
yes. So as I said, it's hard to predict, and I see patients where one daughter has it, but the three sons don't have it, or one daughter has it, the other two daughters don't have it. So there is no way we can predict. The only way we can be 100% sure is to examine those patients carefully. Okay, so if you have a family history and if you have other issues going on with your health, then I would say that see an ophthalmologist, get a good picture, ask them questions about what is my pressure, what is my optic nerve look like, what did you find in my fields, and what was my OCT values, and just note them down. And next time you go and see them, then check if there's any difference. So I would say there is no easy way to detect unless by a thorough examination.
Okay, thank you. I think we'll do a last question.
Okay.
Yeah, because I don't want to take your time. Okay, Ramachandra ji from India has asked, if an eye drop causes irritation or a redness in the eye, does it mean that the eye drop is not working?
Mhm. Well, this is a very common issue and problem. In short, I would say that each one of those drops are chemicals. Okay, they are nothing but chemicals, and each one of us has a different sensitivity. So we tend to respond differently. But remember when I showed you how we put the drops in, and then the drop has to stay on the eye for a few minutes. That can cause irritation. So irritation within is a reasonable irritation that's to be accepted, expected. Uh, but it doesn't mean that this drug is working or not working for you. So the irritation is totally different. So there are a lot of issues. For example, some people will complain about pain as soon as the drop goes in the eye. Some people have issue with itching. Some people, their red eye their lids become swollen. So these are all well-known side effects, and your body just has to find one that is suitable.
Okay, thank you. Thank you very much. I think one question I still have one question. Sometimes we read on the medications that not suitable if patient has a glaucoma, right? Is so glaucoma, I mean, we need to read in every medications if someone has a glaucoma, or is it like a must, or, that's my question.
So um, there are different types of glaucoma. One, the most common is the open angle. The other one is narrow angle or closed angle. So most of these issues are related to closed angle or narrow angle glaucoma. So yeah, if you are under treatment for glaucoma and you have a strong family history of glaucoma, then I would definitely read it. But that doesn't mean that you cannot take that medicine, especially if a person is already taking drops for glaucoma and they have to use this, for example, headache medicine or allergy medicine for 2 weeks. I don't think that'll be a problem. But you can always call your ophthalmology doctor as well.
Okay.
But now steroids is a totally different thing. We didn't get a chance to talk about steroids. That a lot of patients are taking steroids for arthritis or other skin disorders or chronic illnesses. Now those patients have a very high chance of getting high pressure. So they should be checked regularly for glaucoma and cataracts, because the steroids cause both of those conditions very frequently.
Okay, thank you. Thank you so much, Dr. Kuranji.
Welcome. I enjoyed a lot. So I have so many questions that maybe I wasn't able to answer very well, but I'll be reading about it and letting know.
No. It was really, really informative and very excellent. As I told you, mentioned before, like I'm going to talk to my mom and ask her how,
Okay.
what she does. Yeah, yeah.
Yeah.
Thank you
What
so
a
much.
wonderful talk. Thank you very
Wonderful.
much.
Yeah,
Thank you.
thank you
Thank
very
you.
much.
Yeah. Good night.
Good night. Thank you. And I also wanted to just inform everyone, please do subscribe to our JKYog online YouTube channel to get, notification of our any editions that we do, update. And we have started karma yoga in our daily sadhana. We started just today, so do take advantage of that. And then from tomorrow, we are starting Ram Katha Rahasya. So don't miss out that one. And we're starting that because it's a Purushottam Mass, very important month, or a Dik Mass, right? So it is very important that you join and take advantage and get blessings of God, okay, Lord Ram and all. So thank you very much, everyone, and we'll see you next week for another health webinar. Thank you. Radhe Radhe. Namaste.